There are a lot of conversations happening right now around hormones and menopause, but pelvic floor health is still one of the most overlooked pieces of that discussion. Today I'm joined by Dr. Erin Michael, pelvic floor physical therapist, certified menopause coach, and founder of FemPowered, to talk about how hormonal changes, especially during perimenopause and menopause, can affect the body in ways many women are never prepared for. Hi,
Hi, how are you?
welcome. Doing
Thank
well.
you.
So can you give me a little bit about your background and the work you do with FemPowered?
Yeah, I've been a PT for nearly 20 years now, and I actually have been in the neuro PT space for most of my career, working in spinal cord injuries and other paralyzing conditions. But when I was 37 in October of 2020, I was diagnosed with breast cancer. And I was hormone positive. So part of that journey was being put on hormone blockers, and just blocking my estrogen and going into menopause over pretty much overnight. And so through that journey of my own, I saw a lot of the gaps in care. Very specifically, like no one told me what was going to happen to my body. It was just okay, you're going to take this and it's going to hopefully help keep the cancer from coming back, leaving out the 100 other things that were going to change in my body because of this medication. And being young and meeting so many other women who were young and diagnosed with cancer. And it doesn't have to be breast cancer. Chemotherapy in general can throw you into menopause. A lot of women will have surgeries to remove reproductive organs because of cancer or because of other diagnoses. And so this idea that there are so many young women being pushed into menopause with years and years ahead of when it's supposed to actually happen. Um, how can we protect our bodies? How can we mitigate the symptoms? And so as I was looking for my place to fit into the space, my personality, I've always been a person that needs to have a purpose, turn something into purpose. And so having gone through the breast cancer journey, I left it being like, I've got to figure out how I'm going to give back to the community, how I'm going to turn what I went through into helping others. And that landed me in the pelvic floor space. And so, yeah, a couple years after being diagnosed, I started taking courses on pelvic floor PT. And yeah, and then last March, I opened my business, Fempowered, and that is um, as a concierge or virtual pelvic PT. So I either go into women's homes or do some work online, either telehealth or like virtual coaching, basically. hmm
That's an incredible story to take something that you went through, right? That was life changing, and then now turn it into something where you're changing other women's lives for the better.
Yeah.
I love that. What are some of the pelvic floor health changes that happen during perimenopause and menopause that women don't recognize are potentially changes?
Yeah. So one of the big ones is the microbiome shift. And
Mm.
so um, we see because of the changes that happen to the tissues in menopause, the pH of our vagina changes, and that can actually lead to bacterial overgrowth and just dysbiosis. And so a lot of women will see an increase in UTIs and not realize that it's actually related to hormone changes. And then the urethra changes. So one of the things with estrogen is all of our tissues in our body love estrogen. Our all the tissues in our reproductive areas, but then our muscles, our skin, and so one of the big ones, women start getting itchier. Like you're just dry, like your skin's just dry.
I've heard
And
the ear
so
canal. I've heard,
yes,
yeah, if you start getting
yeah,
itchy ear canals,
itchy
that's like a,
ears. Yep,
mhm.
yep. And then the urethra, so the tube that goes from our bladder to the outside, can actually gets thinner and can actually shrink in length.
Oh, wow.
And so, yeah, and so you can see more leak issues with leaking because of that. So women in general, we are at higher risk of leaking of urinary leakage than men are because the length of distance that our pee has to go is so much shorter and so much more direct. But then as we age and the changes that happen to the tissues in the area, that risk of leaking goes up even higher. Um, you can see the changes in proprioception, and so like ability to feel what's happening in your pelvis. Some women even feel like like to feel their muscles themselves, or even to feel any sort of arousal, or it can be harder to achieve orgasm because just the sensation in the area decreases. Um, then speak in going in that direction, sexual dysfunction in general. So our vaginal tissues thrive on estrogen. That's what keeps everything nice and plump. And so as we lose estrogen, the tissues start to shrink and they get thinner. And so you can actually like sex becomes more painful. You may see decreased arousal. There may be pain with sex, pain with uh, we see it turn into kind of this growing fear of like knowing that sex is starting to hurt. And then so each time you go to try to be sexually active, the fear grows and grows. And so it can kind of be a perpetuating problem. And it gets our tissues become less elastic. So the other thing is, as talking about the biome and risk for infection, we can actually get some tears to vaginal tissue. And so the different ways to mitigate that. But you have to know that it's happening to even be able to ask for help or to understand what's happening. So that's been a big part of what I love to do, is just to talk about it, to talk about things that make everyone really uncomfortable. Um, and then bowel dysfunction is another one. We can see more issues with like constipation, difficulty in regularity. Um, that's that's a decent list of
List.
things.
Yeah, I loved how you talked about how your body loves estrogen,
Yes.
because that's kind of one of my messages with educating women on our sex hormones, is that it's not just about reproductive.
Mm-mm.
It's yes, is that part of the system? Sure, but bone health, our gut, our cognition,
Yep.
and so when our hormone levels are altered synthetically or by trauma or by illness, whatever, the effects are downstream, and
Hmm.
sometimes significant, and mood changes and disorders. And then to your point with sexual function, I mean, talk about a cyclical problem, because for women, sex is so much more complex than just being aroused, right? We have
Hmm.
to have that, not have to, for a lot of us, there needs to be safety and emotional
Yes.
connection. Um, Lubrication, I know, is something that can be impacted as well. Why do you think women feel so blindsided by these changes?
The big one is because we're not taught about it. Like,
Yeah, for sure.
it's been such a taboo thing for so long. The like this any talking about women's bodies ever in any way, any shape, form, especially talking about, the pelvic region of our bodies, like God forbid we did that, right? Um, so, so many women, in especially the generations before us, I mean, were going through this thing having no idea what it was or why it was happening, or not even anticipating that it was going to happen. And there was and it was happening in isolation because you weren't allowed to talk about it. So it was this like it's happening only to me, and why and what am I doing wrong, right? Um, and then not knowing this is a natural thing. This is something that's supposed to happen. It's not our body being broken. It's what our body is
Yeah.
supposed to do. Um, it's also it's I would call it it's a silent transition. It can take years. Women can be in perimenopause up to 10 years before actual menopause. So, for the audience, menopause is actually just one day. Menopause is the day that you have reached 365 days without a period. Before that, you're in perimenopause. After that, you're postmenopause. So menopause itself is like a singular day. And but everything that happens in perimenopause, they happen in such a way that you may not recognize that that's what's happening to your body. So you may have some sleep disturbances. You may start noticing that you're having hot flashes, brain fog, anxiety goes up, but they're all happening at different points. And many times women are told they're too young to be in perimenopause. And so we're just like, oh, I guess I don't know, I'm just going through something right now. And so we're not even recognizing that that's what's happening. And then there's this gap in um in our providers education. So, I think it's med schools. I've read that it's like 1 to 2 hours in all of their training is on menopause. um so if our providers don't know much about it, how are we supposed to know much
How are
about
we
it?
supposed to? Yeah.
Yeah. And then kind of so that waxing and waning of symptoms, and then not realizing that the symptoms that you're having could be menopause, or perimenopause. So women will start noticing they're more irritable. A lot of women at this point in life, so in mid 30s for early 40s, will their anxiety is going up, and so they're being put on anxiety medication. And no,
Antidepressants.
yeah, antidepressants, anxiety. Yeah, nobody's telling them that might be that their hormones are plummeting one day and going back up another day. Um, Memory issues, the brain fog, the just like, and you can attribute it to this, the time of life, right? Like, especially now, we're this sandwich generation where we're taking care of children and aging parents, and we're trying to maintain our career. And so you can kind of think like, oh, I just must be really burnt out or tired or like, and so I just need to rest, or I don't have time to take for myself. So I guess I'll just have to deal
Keep
with the
going.
feeling like, yeah, I just guess I just have to feel like keep going with feeling like I'm stuck in a cloud. So yeah, I think those are kind of the big ones is like mostly it's just no one knows. We just don't know enough about it
Yeah.
to recognize that that's what's happening.
Yeah, and and like to your point, culturally, whether it's puberty, whether it's pregnancy, whether it's postpartum, whether it's perimenopause, menopause, there tend there has been, again, not for everybody, but there has been this dismissing of symptoms and you're
Hmm.
crazy and it's just you. And the education piece of it helps us recognize there are physiological and biological things happening that, like you said, are natural and normal. And when we can learn those symptoms and signs, we can work with our bodies, we can
Hmm.
support our bodies.
Hmm.
And that is so powerful.
Yes,
But if
that's
we're
what I
stuck in the
mean.
dark, but
Right.
if we're stuck in the dark, blame, I mean, I can't, I mean, I'm sure you experience this too. How many women I talk to, and they're just like, I'm a bad sleeper.
Hmm.
I, you know, I don't, I'm just never hungry, or I'm just an anxious person. And you're like,
Hmm.
these things are not your identity. They're
Right.
not your personality. I think there are ways that we can maybe address it, right?
Hmm. Hmm.
What are, I mean, you kind of touched on a lot of them, but are there any other kind of misconceptions that you run into when it comes to perimenopause or menopause?
Ooh, misconceptions. I mean, I I think the biggest two are that that you're broken.
Mm,
It's not, we're not, and I think for women, we're made to feel that way a lot. Right? Like, the wellness industry thrives off of us feeling like we need to fix ourselves. And so this understanding that this is a natural thing that happens. This is a normal thing that happens. This happens to every human woman that ever exists. um, and then secondly would be there are options. We do not have to suffer in silence. We don't have to just put up with it, because that's, we've been pressed out of doctors' offices over and over and over and over, of just like, this is just part of aging. It's okay. Those hot flashes, just like ride the wave. um and you don't have to, you don't there's and that's the thing when I do these when I do workshops, and you go through the list of things that happen to your body, and all the faces are like, oh no. And it feels like this it feels like this doomsday thing, right?
Yeah.
And I'm saying, like, just I'm going through this part, just hold on, I promise we're going to leave here with some hope. And um and there is, like, if you know what's happening to your body, you can do things to help yourself. But if you don't realize what it is that you're going through, or if the people who you're going to are telling you that you just have to live with it and just move on, then you're not going to be able to do anything about it. And so I think it's just the more that we speak about it, and I'm very glad that it's kind of it's a pretty hot topic right now.
Yeah, it is.
And why is that? Because there's so many more women in healthcare now, right? There's so many more female physicians and female researchers, and people who are just not afraid to be like, this is part of being a woman, and so let's shout it from the rooftops. So, but yeah, I would say those are the two. Like, you're not broken, and we do have options to help with mitigating symptoms. We don't have to suffer.
Indeed. Yeah, that's
Yeah.
that whole narrative. I'm excited that there are more women like yourself out there
Hmm.
preaching the message, and also not just trying to like preach a certain narrative to sell a certain thing, right? Like,
Hmm.
have all this fear, and this is why you need to take this, because if you don't do this, you'll be feeling. And it's like, no, no, no. Let's understand our bodies. Here are all the options. Your specific situation may do well or may not do well with these treatment
Hmm.
options.
Yeah.
Um, if
I
someone's
Oh, and
oh,
sorry, I just
no, go
like
ahead.
thought of another. So the with pelvic floor dysfunction, right? So if you're having leaking or pelvic pain or urgency or what, list goes on. A lot of times providers will say just to do Kegels, right?
Oh my
So
gosh,
we'll do,
yes.
so I've heard the one that I hear a lot is like do 100 Kegels a day. I'm like, good God. But the big thing is that a lot of times for women, we have hypertonic pelvic floors because we carry everything inside of our bodies, and we keep our teeth really clenched, and we wear our shoulders as earrings, and we're just always holding things in. And then, so if you're strengthening a pelvic floor that is already tight, we could actually be creating, we could actually be worsening the issues and the symptoms. You could be doing Kegels and see that your leaking is getting worse because you're actually creating more muscle dysfunction. And the other thing is, a lot of times when I'm evaluating a patient, like one of the first things I'll look at is, show me what you think a core contraction is. Show me
Oh,
how you activate your deep core. And then also tell me, all right, do a Kegel for me, what you think a Kegel is, and it will be not, and it's not quite right. And so then if you're doing that on your own, so then now we're just perpetuating abnormal movement patterns. And so again, can be creating more of an issue,
more
than fixing it.
dysfunction.
Hmm.
Yeah, I find, especially with like strength athletes or gymnasts, even swimmers, even that tendency to have a tighter pelvic floor. And then
Hmm.
you're thinking, like, I just have to bear down. I know me personally, lifting heavy. When I went through pregnancy, I went to a pelvic floor PT because I was having a lot of issues. And she was like, girlfriend, you need to relax.
Hmm.
And I just totally blew my mind that for childbirth, especially that relaxing, that lengthening is what the goal is. Not this what you see on TV where women are like screaming and bearing down and
Hmm.
pushing. Yeah, it really does. Again, the more you know, the more you
Yeah.
can help
Well,
yourself.
and speaking of other misconceptions, not necessarily menopause related, but that the only people that can have pelvic floor issues are the women who have given birth.
Oh no, no.
So a lot of people think pelvic floor PT and they think pregnancy. I am a lifelong athlete. I started playing soccer when I was 4, and now I'm a competitive power lifter. I have never given birth, but I've definitely had pelvic floor dysfunction, and a lot of girls in high school have leakage and at that age, just
Yeah.
from, yeah, being an athlete, and it's a common thing. And like, I remember so as part of this experience, I went to a pelvic floor PT and had the whole exam done on me. And I remember she was like, "Okay, do a pelvic floor contraction," and I did. And she said, "Okay, relax." And I thought I did. And then she said, "No, relax. You can relax now." And I was like, "I did." And she's like, "Oh no, no, you didn't."
Oh yeah.
And so I literally didn't know how to turn my pelvic floor off. And come to find out, speaking of straining, like, I haven't strained to give birth, but I used to, like, that was what I thought pooping was. Like, you just had to push it out to get
Oh
it out.
yeah.
But now I have a potty stool and I know how to actually relax my pelvic floor, and pooping goes a lot more smoothly these days. Like, and I'm not creating issues for myself, like more pelvic floor dysfunction or hemorrhoids or Lord knows, so like, the fact that poop can just kind of slide out, I didn't know that for a long time.
Yeah, we don't, and again, we don't talk about that stuff.
No.
And you have going back to like young teenage girls learning about their bodies and their menstrual cycle and being active in sports. And there's all these elements that if we could just tell women how their bodies work, or provide them that knowledge, man, we could just definitely help prevent those issues when you're in your 30s, 40s, 50s, 60s, and
Hmm.
beyond. If a woman is listening to this and she's like, oh man, I feel disconnected from my body, where can she find you and your resources?
Yeah, so I'm beefempowered.com is my website. I'm also on Instagram, at b underscore fempowered. And even Fempowered Women's Health on Facebook. My website, I have a blog where I give a lot of, I do at least, it's monthly or bi-monthly, blog articles. You can sign up for my newsletter where I just send out free information every month. So yeah, and there's some really simple stuff that we as women can do, to feel more connected to our pelvic floors and our bodies.
Well, I appreciate your time. Thank you so much for coming on. Please make sure to check out Dr. Michael's all of her resources, her website, her Instagram. You had oh yeah, her newsletter, her blog.
Yes.
It gives all this good information. So make sure you guys check it out. And we'll see you in the next one.